Advocates call insulin the vial of life. Newsom first promised to lower prescription drug costs in 2019, his first year as governor.
If I don't have insulin, I'll die in a few days.
Christine Falabelle lives with type 1 diabetes and has to take insulin daily. That's why she stood alongside the governor Thursday for a life-changing announcement. Starting January 1st, 2026, insulin pens will be available at pharmacies for $11 a pen, $55 for a 5-pack of 3 milliliters.
That's the most anyone should ever have to pay, even if they show up in the pharmacy without any insurance.
They say anyone is eligible. That's thanks to CalRx, California's program to make its own supply of prescription drugs for cheaper. Newsom noting that current costs of insulin from name brands can range from as low as $89 to $411.
I'll say it, Big Pharma. To disrupt this multi-billion-dollar market. 90% of insulins in this country, 90% share are in the hands of just 3 big companies. And they have been gouging you for years and years and years.
Advocates agree.
I have given myself 67,333 insulin injections, 76,952 finger pricks, 2,748 days recovering from a hypo since being diagnosed in 1999.
For them, insulin is a life-saving medicine, not a choice, not a luxury, and it's not something they can cut back on when finances are tight.
This rollout will be long-acting glargine insulin pens, the generic for Lantus, which helps regulate blood sugar levels. The administration says up next under CalRx are albuterol, GLP-1, also for diabetes, and even vaccines. The news comes days after Newsom signed into law a bill that limits copays for a 30-day supply of insulin to $35.
Just the constant threat of not having health insurance and the rising cost of insulin is always a stressor.
Jenny Ha, CBS 8.